So this is Professor Dinesh John. He's new at Northeastern. He's coming more from the health side, but works in physical activity measurement and sedentary behavior. So he'll give you a quick sense of what he does.
Sure. So basically, I'm an exercise physiologist by training, but I'm interested in using technology in the kind of work that I do. I use it in different ways, primarily to measure physical activity and sedentary behavior, quantify it accurately, and also to measure physiological variables that are associated with physical activity, adaptations to sedentary behavior, those kind of things. The title of my presentation, Sedentary Behavior Measurement and Workplace Interventions. Like the title says, I focus in intervening at the workplace to reduce sitting time quite a bit. Just to give a brief background, the nature of human occupation has changed over the course of time. We started off as hunter-gatherers. We moved on to being agriculturalists, and now the technology has advanced so much that we are primarily relegated to sitting down at the workplace most of the day. We are all sedentary right now, sitting down, and we're having issues with that. So the problem with sitting continuously is that it's shown to be associated with increasing the obesity rates in the country. Obesity is one of the biggest problems that's facing America today. About 2/3 of the population is either overweight or obese. And sitting continuously for a long period of time has shown to increase the risk for cardiovascular disease, metabolic disease, cancer, and other problems. So primarily, a lot of folks believe that modernization and technology has increased sedentary behavior. 75% of the American population sits in front of a computer at work, like I said. People sit more during weekdays at work rather than weekends. So what I'm interested in is trying to use the same technology that causes us to sit to try and get us to be more active or change the sitting pattern, sitting behavior that we have. I've done some kind of work in this. There are some ideas out there that are being implemented at the workplace these days. It's trying to get people to stand at the workplace and work, break sitting time, and people also try to be more active by putting in treadmill workstations at the workplace. This is the kind of technological innovations that I've used in the kind of work that I do. These are the interventions that I've done. I've done a study where we showed that actually using the treadmill workstation has a good beneficial effect on decreasing weight and improving cardiovascular and metabolic profile. And I'm also very interested in changing behavior at an organizational level rather than an individual level. So trying to get the companies and small institutions to actually get this behavior modification, not at an individual level. People should do this at a much bigger scale for improvements to be visible. I also use technological sensors to quantify physical activity. People usually use questionnaires to do this, but there's this boom in using sensors to quantify physical activity. It's very beneficial because we get a better fix on how active people are, and we get a proper idea of the dose-response relationship between physical activity and sedentary behavior and health. These are some of the sensors that I've used previously. These are acceleration sensors that I use. These are commercially available sensors. I also work with using with developing algorithms to get these sensors to get a better estimate of physical activity and sedentary behavior. I'm investigating the use of RFID technology to actually get an understanding of how much time people spend at a particular place too. And some other small sensors that are commercially available, like temperature sensors, that will help me determine when these activity monitors are worn on the person and when they come off. So these are things that haven't been looked at, but I'm looking at advancements in technology to incorporate into my work to get a better understanding of how to measure physical activity and sedentary behavior. Some of the tools that I use to measure physiological changes that haven't been used before are, this is an example here. This is a continuous glucose monitor. So what this monitor does is that it gives me a continuous reading of the person's glucose levels in the blood at 5-minute intervals, and I'm able to see how changes in posture, for example, the case of sitting to standing transitions, how it improves or changes the glucose levels in the body. I'm also using blood flow variables and EMG measurements This is a wireless EMG tool that's available nowadays. What I'm using this for is to see how people change their patterns of sitting and standing. We cannot use acceleration sensors to determine this, but this is a new invention that's, there are a few manufacturers that have come out with this, and I use this to see how people change their sitting patterns and how it's affecting musculoskeletal variables. One of the fields that I really haven't explored is the use of modern technological tools to actually motivate behavior change. Some of the tools that I've used a little bit in my work is this particular monitor that actually detects how much you're sitting. And when it detects a certain period of sitting, time spent in sitting, it actually buzzes and reminds you to get up and start walking. Another intervention that I want to start working with is the cell phone technology that Stephen uses, and we're actually trying to collaborate on a project with this. This is actually to try and develop a messaging system that will actually give a positive message or remind people of how much they've been sitting, and actually tell them to get up and move and be more physically active. That's a quick synopsis of what I do. Sorry, I spoke very fast.